Good evening. We're sorry for being late. We have some technical problems. We have a lot of excellent speakers and excellent topics tonight. And I will start right away with my presentation. It's about tips about physiology and gonadotropins. So, of course, we know that primordial follicles take about 280 days to grow till they become pre-antral follicles. And what we use to measure ovarian reserve depends on the test. So if you're using AMH, it measures follicles that are before class 5 follicles. Whereas if you are using antral follicle count or FSH, you're measuring follicles above class 5 follicles. So they measure different things. AMH measures apotential, whereas AFC, the antral follicle count, measure the actual power of the ovary right now. After the follicles reach 5 millimeter, they start growing in two phases. Phase 1 starts right after ovulation, and it is a minor phase. Follicles do not attain an ovulatory size because LH is lowered by the progesterone increase. Whereas wave 2 starts after menses, and it is a major wave where follicles can grow up to a size of 20 or more, where they can rupture and ovulate. So this is wave 1 and wave 2, and this is the principle of that we use induced stimulation, Shanghai protocol, or whatever. Wave 2, which is the follicular phase, wave is divided into two phases. The first half of the follicular phase is when follicles are smaller than 12 millimeters and they don't have LH receptors on their granulosa cells. These granulosa cells contain only FSH. Whereas after the follicles attain 12 millimeter size or so, they start to acquire LH receptors on their granulosa cells. In the first half of the follicular phase, the recruitment is done under the effect of acidic FSH. Whereas in the second half of the follicular phase, the growth maintenance is done under the effect of LH, and there are several studies that showed that LH after size of 12 can maintain follicular growth. There are several types of ampoules that we use, and they all contain LH, HCG, or FSH. The alpha subunit of all the three hormones is similar. It contains 92 amino acids, and it contains 2 carbohydrate side chains. The difference is in the beta subunit. In the LH, it contains 1 carbohydrate side chain. In FSH, it contains 2 carbohydrate side chains, and in HCG, it contains 6 carbohydrate side chains, and this is why HCG is the longest duration of action. The types of ampoules that we use are urinary HMG, urinary FSH, highly purified HMG, highly purified FSH, urinary HCG, rec HCG, rec LH, and rec FSH, and the biosimilars, which of course are also rec. The FSH activity in the ampoules that we use differs. In urinary products, it is acidic FSH. It has longer duration of action and weak potency, and it contains a lot of cyric acid on its carbohydrate side chains. Whereas in rec FSH, it is basic, it has more potency, but shorter duration of action. LH activity is obtained from LH and HCG, which is added or obtained from pituitary or circulation. The older compounds used more LH, whereas the more recent compounds has more HCG. And so we have to be careful when we use the recent products of highly purified HMG that they contain more HCG. HCG of pituitary origin or HCG of pregnancy origin, and they have different potencies. And if we used large doses without making sure that these are taken into consideration, we could end up with loss of folliculogenesis or the potential of folliculogenesis. So this is the only tips that I wanted to say today. And I want to introduce to you an excellent course that will be presented by Professor Salah Rashid, and it will start by EFRE, and it will start on August 3. It will continue for 2 months. And it has a lot of excellent speakers. And also there is the next webinar of EFRE will be produced on patient selection and preparation for IVF and evidence-based approach. I would like to thank very much Professor Yaqub Khalaf and Professor Bedawi from Canada and from England for their continuous support of EFRE activity. I would like to thank Professor Mu'min Kamil for arranging this excellent webinar, and of course, the 3 excellent musketeers, Professor Nasr, Professor Ahmed Youssef, and Professor Salah Rashid for the upcoming webinar. And at the end, I would like to thank you very much for listening to me these 5 minutes.